Hey guys, welcome back to my YouTube channel. Today we'll discuss about belladonna. Belladonna, common name, deadly nightshade, Atropa belladonna solanaceae. Introduction. The word atropa is derived from atropos, whose meaning is inflexible, the name of the great fate who cuts the throat of life, and probably eludes the poisonous effects of the drug. The word belladonna is from the Italian bella, whose meaning is beautiful, and donna means lady. The juice of the berry, when placed in the eye, sparkles, giving a striking appearance. Its mydriatic properties were first recorded in 1802. The analgesic property was not recorded till 1860. Hahnemann introduced it into the homeopathic practice. Let us see constitution. Appearance. Since belladonna is more or less an acute remedy, no serious importance is to be attached to the constitution. However, it is adapted to bilious plethoric persons with red face and to a condition in them of local plethora, that is inflammatory state with throbbing, pain and redness, and also those having lymphatic constitution with fine complexion and delicate skin. Temperament: bilious, lymphatic, and nervous temperament. Miasm sora is in the background. Diathesis, tubercular diathesis. Let us see mental generals. Imagination: he sees ghosts, he sees hideous faces, he sees various insects. Fear of imaginary things, wants to run away from them. Mourning, aversion to noise and company. Instead of eating, bites wooden spoon into two, gnaves plate and growls, and barks like a dog. She will sit and break pin into pieces. Absent-minded and forgetfulness. When closing the eyes through not sleep, patient sees fierce, weak-looking large animals with horns and bushy heads and room full of strange persons. Delirium tremens, which means it is the most dramatic and grave consequence of alcoholic complication, characterized by profound confusion, vivid hallucination, tremor, agitation, sleeplessness, as well as increased activity of autonomic nervous system, that is dilated pupil, profuse perspiration, tachycardia and fever. Violent delirium breaks into fits of laughter, then gnashes teeth, disposed to bite and strike those around. Rage, madness, disposition to bite, to spit, to strike and tear things, desire to escape and hide herself, jumping out of bed with fear, trying to run away and hide. Furious delirium, bites his attendants and himself, screams furiously. Mania, highest degree of mania, complete restlessness, he jumps on chairs, tables and stove. Fury with grinding of teeth, convulsions, and attacks those who are nearby. Mania with excessive craving for snuff. Voracious appetite, generally constipated. Wild unsteady look, eyes brilliant, face flushed, breathing anxious, irregular, sexual excitement, inclined to masturbate, sleeplessness and restlessness. Physical generals: aversions, acid, coffee, drinks, warm food, smell of milk. Desires: beer, cold drinks, lemonade, then sweat. During sleep, during convulsion, on covered parts, stain the lining before stool, suddenly disappearing. Sleep. Sleepy but cannot sleep. While sleeping, sings and talks around, moaning and tossing about. Sleeps with half open eyes. Dreams. Anxious, falling off, fire, frightful, ghost of misfortune, of being pursued by giants, squirrels, and remembered swimming in water. Appetite, loss of appetite. Thirst, excessive thirst for cold water, and there is absence of thirst also. General modalities: aggravation from touch, motion, noise, draft of air, looking at bright shining object after 3 p.m., night, after midnight, while drinking, uncovering the head, summer sun, lying down, least desire and motion, strong smell. Amelioration: rest, standing or sitting erect in warm room. Side: right-sided remedy. It also affects the left side of the eyes, nose, face, mouth and fauces. abdomen, neck and nape of the neck, chest, upper extremity, lower extremity, left upper side, right lower side. Guiding symptoms. Pain usually in short attacks cause redness of face and eyes, fullness of head and throbbing of carotids. Quick sensation and motion. Eyes snap and move quickly. Pains come suddenly, last indefinitely and ceases suddenly. Great liability to take cold, sensitive to draught of air, especially when uncovering the head. From having haircut, tonsils become inflamed after riding in a cold wind. Head hot and painful, face flushed, eyes wild, staring, pupils dilated, pulse full and bounding, globular like backshot striking the finger, mucous membrane of mouth dry, stools tardy and urine suppressed, sleepy but cannot sleep, rush of blood to head and face, headache, congestive with red face, throbbing of brain and carotids. Aggravation from slight noise, jar, motion, light, lying down, least exertion, pressure, tight bandaging, wrapping up during menses. Boring the head into the pillow, vertigo when stooping or when rising after stooping, on every change of position. Abdomen tender, aggravation by least jar even of the bed, oblique to walk with great care of fear of jar. Pain in right ileocecal region by slightest touch, even that of the bed cover. Transverse colon protrudes like a pad, pressing downwards as if the contents of abdomen would issue from the vulva. Amelioration on standing and sitting erect, worse morning. Skin of uniform, smooth, shining, scarlet redness, dry, hot, burning, imparts a burning sensation to the examining hand, the true sydenham scarlet fever when eruption is perfectly smooth and truly scarlet. Patient. Particulars in fever. Belladonna is almost as swift as an arrow in its action and is violent in its effect. It brings on pain that disappears as suddenly as it appears. It makes itself easily recognized by heat, redness, burning, and throbbing. Moaning during sleep, half awake, half asleep by its hot head, extreme sensitiveness to pain and to special senses, and last but not the least, by its fury and rays, which I had the opportunity of once witnessing when a patient howled and growled like a tiger. Patient complains that she or he is suffering from fever which has started suddenly and violently, and fever comes at 3 p.m. every day. Her fever begins with a chill of congestive nature along with natural heat. There is burning heat externally. Her extremities, especially legs, are icy cold, whereas head is very hot. There is sudden rise of temperature with a bright flushed face which becomes bloated and lastly mottled. She has also bursting headache with throbbing of carotids, dilated pupils, dread of light and noise which accompany the chill. She has sweat on the covered parts and on the head. There may be complete lack of sweat. If sweat occurs, it appears and disappears suddenly. The stage of heat is extremely violent. If you place your hand on the patient, you will surely withdraw it. There is burning of the whole body both externally and internally. The patient is very restless. In spite of this intense heat, she is very sensitive to draught of cold air. So she is always covered up. Her pulse is of high volume and high tension. It is like of stroke of a small hammer against the examining finger. Her tongue is strawberry like, or sometimes tongue becomes inflamed and looks quite swollen with prominent papillae. She is completely thirstless during fever. The patient has confusion of mind, anxiety, trembling of body with furious delirium. She has also maniacal excitement in delirium. Excitement runs all through the mental symptoms. The mental symptoms are active, never passive. The patient is wild, striking, biting, tearing things, and doing strange things. The delirium and mental symptoms are relieved by eating a little of light food. He is full of imagination, sees ghosts, spirits, and wild things. In the early part of delirium, there is violent delirium, but as it passes on, it goes into a sleep. A semi-comatose condition. In delirium, he sees ghosts, hideous face, animals, and insects. She wants to run away from them, breaks into fits of laughter or screams and gnashes his teeth, bites or strikes those around. In short, he performs all sorts of violent acts and is controlled with great difficulty. The patient barks like a dog. She doesn't like company, has aversion to light. The strange feature running through fever is that he has an unconquerable craving for lemon juice. Thirst for water changes to thirst for beer. In GI tract, the patient complains about the GI troubles. Her mouth is very dry, with or without thirst. In tongue, great dryness of throat. Fauces are red as in scarlet fever, very hot with burning sensation. After some time it grows dusky, finally mottled, which is worse on the right side. During deglutination, feeling in the throat as if it were too narrow, as if nothing would pass properly, even the least liquid passes out of the nostril. Constant urging and the desire to swallow. Tonsillitis worse on the right side with burning like coal fire. In vulva, red swollen, inflamed with burning pain. In stomach and abdomen, it is highly useful in gastritis, gastralgia. There is nausea and vomiting after meal. Pain is violent, recurring, comes suddenly and goes suddenly. Extending to spine, pain in cramping and pressing in nature, relieved by bending backward. Sometimes it is relieved by bending forward. There is burning sensation. Face is very red and hot. Vomiting is of undigested food with much bile or blood. Burning sensation in stomach and epigastric region, which is aggravated by motion. Region of liver is very sensitive and painful, hot with burning sensation, which is worse when lying on right side. Violent cutting, pain in hypogastrium, now here and there. Colic from gallstone is found. Tenderness of the abdomen aggravated by the least jar when walking or stooping, or even the bed or chair upon which sits or lies. It is useful in inflammatory condition of the abdomen such as peritonitis, great distension of the abdomen, sensitive to touch. The sensitiveness is so acute that the patient can hardly bear the bed cover and pressure of cloth, constriction, pain and heat. Around the umbilicus, violent cutting pain in abdomen, tenderness, aggravation by least jar. Long-lasting painfulness of whole abdomen as if it were all raw and sore. In dysentery, the stools are thin, greenish, bloody or pepscent white. They are small in quantity, frequent, involuntary with red and flushed face. Sometimes occurs during dentition of children and as summer complaint of babies. In meningitis, it appears suddenly and violently due to exposure to cold wind, draught of cold air, heat of sun. There is stupefying headache from neck to head with heat and pulsation, red and flushed face, throbbing of carotids. Head is inclined to bend backward. There is congestion and burning sensation in the head. Grinding of teeth with inclination to bite. There may also be irritability and acuteness of the sense of the taste, smell, touch, sight and hearing. Extraordinary twitching of face. Sudden jerking while falling asleep. Urine is retained or there may be involuntary urination. In cough, patient complains of cough. It comes on from crawling in the larynx as if a little speck of something had crept into the larynx. A little dust or a little food or a drop of water has entered into the larynx. Cough is of dry spasmodic type. Sensation as if larynx is inflamed, swollen, constricted. Cough at night, waking after midnight. Cough when lying down, more at night than in a daytime. The cough is spasmodic, barking, short. It is also a remedy for whooping cough with spasm of larynx, which causes woof and difficulty of breathing. Attack of cough ends in sneezing. This remedy cures pneumonia and pleurisy, especially of right lung, with great pain, extreme soreness of part. Patient cannot lie on it. Aggravation from jar of the bed. Laryngitis with sensitiveness, sudden attack of hoarseness by every motion or slightest attempt to talk. Moving head backward or moving the head from Side to side causes pain, swallowing aggravates screw-like spasm with dryness of larynx, aggravation by least jar motion, dot of cold air after midnight, amelioration in warm room, rest open air, wrapping up by standing. Thank you. Please subscribe my YouTube channel and do like, comment and share.